Getting the room.
Hi, my name is Jocelyn Invernon. I'm an AD student at Williston State College, and today for my skill, I'm going to be pulling blood off the central line to go to lab, performing a sterile dressing change, and administering a medication to a central line. So to begin, I have my healthcare provider orders and my MAR, and I'm going to compare to make sure they match. So he ordered, or the provider ordered, a central line dressing as well as ceftriaxone 1 gram IV push every 8 hours and a flush the central line with heparin lock now. So that matches, so I'm going to go ahead and discard my orders and just move forward with my MAR. So first thing, I am in my client's room. I'm going to have him verify chest or chest, 07-19 of 19. I have checked his wristband, as well as making a note for his codeine allergy. And nothing we're doing today has codeine, so I know we can safely move forward. While I'm in here, I'm just going to go ahead and turn off the IV infusion that is infusing into the central line and disconnect it. So by the time I'm back, it'll be 10 minutes and we can proceed. I've explained the procedure to Mr. Chest. He has absolutely no questions, so we are going to go ahead and move forward. So first thing, I'm going to gather supplies and come back into the room. So it's been 10 minutes. I know that I can go ahead and proceed with this obtaining blood. So I'm going to go ahead and provide privacy, don clean gloves. Like I said, Mr. Chest has no questions. And while I'm doing this, I'm just going to visualize the field. No edema, no redness, and he isn't verbalizing any pain. So first thing, I'm going to clean the end of the central line hub with alcohol prep, 10 to 15 seconds, allowing that to air dry. Going to prep my first flush, making sure that there's no air bubble, and I'm going to go ahead and attach it, unclamp, aspirate for blood flow just in the line, not in my flush, and that's confirming patency, so I'm going to go ahead and flush using the pulsatile method, all 10 mils of the syringe. While maintaining positive pressure, I'm going to go ahead and clamp this. Discard. Nope, I'm not. I would not have done that. I would have drawn back a full 10 mils of blood first, and this is going to be discarded into hazard, and then I'm going to get my clean, my new clean syringe. I have maintained sterility of the end of this hub. I'm going to go ahead and unclamp, pull back 10 mils of blood, clamp, give this to the phlebotomist that's in the room with me to take down to lab for me, discard, going to prep another saline flush, and flush one more time, unclamping using the pulsatile method. While maintaining positive pressure, I'm going to clamp that off and discard that syringe. So I would have observed my client, made sure that they handled the procedure well. I'm going to go out and document everything that we did today, making sure that lab draw is in there. And now I'm going to go ahead and prep for the sterile dressing change. So first, I'm going to put new clean gloves on so I can go ahead and prep everything here. So my sterile kit for this dressing change isn't expired, so it's safe to use. I'm going to move the bed to a working height, as well as lower the head of the bed and instruct my client to turn his head away from the insertion site. I'm gonna grab the mask out of my sterile pack and apply that to my client as well, just for extra measure. I'm going to go ahead and next grab the sterile dressing. No, I'm going to grab my gloves and set those aside here. And then I'm going to go ahead and grab my dressing, which is not going to be sterile. It's just going to be against the patient's skin here. He has no questions moving forward, so I'm going to just go ahead and begin by palpating the area while observing it. He is not verbalizing any discomfort or tenderness. I don't see any edema, redness, or any oozing, so that is good. And I'm going to go ahead and begin by taking this off. Okay. For the purpose of this video, it is really hard to get this off this mannequin, so I'm not going to be as gentle as I would be in practice. Oh my gosh. There. So while doing this, I'm making sure to hold pressure on the site so I'm not pulling that catheter out of his skin. Like I said, I would be much more gentle in practice, but this does not want to come off. Okay. Okay, now that that's off, while I'm here, I'm going to go ahead and remove this antimicrobial patch and discard that as well. And I'm going to go ahead and don my sterile gloves. Okay, so I know that I need to apply my sterile gloves to my non-dominant hand first. So I'm going to go ahead and use my dominant hand to pinch this cuff here on the outside. I'm going to go ahead and insert my fingers. And only grab the cuff while sliding that on. I'm going to go ahead and insert my fingers underneath the cuff of my dominant glove here. So I can apply it. There. Okay, so I'm going to go ahead and discard that. And so next I'm going to go ahead and grab my prep out of my sterile packaging here. First thing I would do is make sure that I have measured my central line to make sure that this hasn't shifted and it's still in place like it should, and compare that to previous results. So my non-dominant hand now is going to be unsterile because I'm going to keep the line out of the way while prepping the skin. So I'm going to go ahead and, in a circular motion, starting in the middle, go around my central line, cleaning it. And the last thing I would do is clean the line. Being very gentle. Drop that in the trash. Next, I'm going to go ahead and use my tweezers and gauze to help dry the area as well as let it air dry. Here. Done with that. Next, I would apply an adhesive underneath this antimicrobial patch. There's a foam piece that needs to go to the skin, so I know that that's the correct way to put this on. I'm going to gently lift that up, slide that in. I would also use my cotton tip applicator to remove any crusties that I saw before doing that, as well as making sure that it's in the correct place. Get rid of this. Next thing I'm going to do is grab my occlusive dressing here. And that would not have come out of my client's chest so easily, so I'm just going to pretend like that didn't happen and just put it right back in. So let's pretend like that didn't happen. So I'm just going to go ahead and take that part off of my occlusive dressing and place it over here. making sure that it is to the skin well, taking the outer edge off. Here. Now this little part of the dressing pack, I'm going to go ahead and place near the dressing, and over it I'm going to go ahead and put my initials, the date and time that this was changed. So now I can take off my sterile gloves and clean up my procedure area. Making sure my client tolerated this well, feels okay. So next I'm going to go ahead and do my medications. So I'm now in my med room. I'm going to go ahead and perform hand hygiene and put on a clean pair of gloves. I'm going to go ahead and pull my meds out of the Pyxis now. So first, I know that I need a ceftriaxone 1 gram IV push. So there's that. I need a heparin flush 500 units in 5 mils. Heparin flush 500 units in 5 mils. So I'm going to go ahead and now have my second nurse verify the dose on this.
Yep, looks good.
Okay. Next, I'm going to prep my flushes just to be prepared when I'm in there. Maintaining the sterility of those while doing so. And then perform my second medication check before going to the room. So once again, ceftriaxone 1 gram in a vial, pre-mixed, and then 5 ml fill in a 12 ml syringe for 500 units, or 500 units per 5 mils of heparin flush. So now that I have my meds, I'm going to go to my client's room and do my third medication check, take off my gloves. Now in my patient's room, once again, I'd verify patient, same with verifying the allergy, make sure he has no questions, also educate him that we're going to give him his last dose of ceftriaxone because he's going home, and that is why we are going to give him the heparin lock now. So I'm going to now perform my third medication check at bedside. This is ceftriaxone 1 gram per vial, as well as heparin IV flush syringe 500 units per 5 mils. So that is correct. I'm going to go ahead and perform hand hygiene, put on a new pair of clean gloves, provide privacy, make sure he has no questions, and begin. So once again, I need to make sure to prep the hub of the central line. 10 to 15 seconds, making sure that it air dries. I'm going to go ahead and flush. Already prepped this, so I don't need to get the air bubble out. Going to unclamp. I'm going to aspirate, confirm patency. I'm going to go ahead and I saw blood flow, so that is good. Now I'm going to use the pulsatile method to flush the full 10 mils of the syringe. Maintaining positive pressure, I'm going to clamp the line, discard this. Next I'm going to do my ceftriaxone here. Keeping that sterile, I'm going to go ahead and unclamp, and I know that I need to push this over 3 minutes, but for the purpose of my video, I'm just going to go ahead and push it in. Maintaining positive pressure, I'm going to clamp, discard, flush again. This is already prepped, so I can just go ahead and attach it, unclamp, pulsatile method. Maintaining positive pressure, clamp again, discard, and my last flush is going to be the heparin. I'm going to attach this, unclamp, and slowly as well use the pulsatile method. Just making sure that my client isn't having any adverse reaction while doing so. Maintaining positive pressure, clamp. I know that the purpose of this heparin lock is to remove any fibrogen that could build up in his port, as well as preventing any clots from forming while he is at home. So now I would clean up my station, document everything that I've done, which would be, once again, the dressing change, date, time, how he tolerated it, the amount of flushes that I used, as well as the amount of medications that were put into his port, how he tolerated it, and clean up and leave the room.